Francis, I haven't seen 3 more panelists. Can we follow through if they're joining shortly?
They will be joining shortly, but you can continue.
Oops. Good afternoon to you all. This afternoon, I am your moderator, Professor Adres Malata. I just want to be sure you all can hear me.
We can hear you, Prof.
Thank you very much. We will start with some housekeeping reminders to both the panelists as well as the members of our audience. And I'm just trying to share my screen now. So just housekeeping rules once again, just kindly mute your microphone when you're not talking, unmute your microphone and enable camera when you're talking. Please stick to the time allocated to you. I think we have set for the presentation initially is 10 minutes. And at the conclusion, we'll also give you 3 minutes to give your concluding remarks to each one of you. Remember that we have a Q&A box, and you need to keep checking. There might be questions being directed to you. You need to respond to them, I think, later on. But if there are general questions, any of you can take those questions and I'll be directing that particular session. You can choose to answer live during the Q&A session or respond by text to the same Q&A box. For all our attendees, welcome again. Please use Q&A box to write any questions you may have. Specify the panelist you are directing your question to. And please use the chat box, and some of you are already using that for comments and interactions. And remember that if you need help with translation, you can actually choose a language of preference, and there will be simultaneous English, French, and Arabic translations. Please note that for the Arabic translation, it's under the Chinese channel. Choose mute for mute original audio if you want to hear only the interpretation, but if you want to hear both, then you can choose not to unmute audio so that you are able to hear both questions. Enjoy this session. Thank you very much. So as a preamble for this webinar, I want to welcome you once again. And just to say that this afternoon, and it's afternoon in Malawi, it might be morning elsewhere or evening elsewhere, but we'll be looking at universities' role in preparedness and response and monitoring of emerging and re-emerging pandemics. We all know that the new and re-emerging infectious diseases cause so much human suffering worldwide. And I think COVID-19 is a typical example of how much suffering is taking place in the world now. Many of these diseases are zoonosis with epidemic to pandemic potential. The recent outbreak of the novel coronavirus, COVID-19, has raised global awareness of the devastating effect that emerging infectious diseases have on human populations and economies. Africa, as we know, is highly biodiverse with large rural populations that are highly dependent on nature, livestock, agriculture, as well as consumption of wildlife and wildlife products. We all know that there is increasing food and nutrition security demands. Intensification of livestock and agriculture is required, leading to invasion of forested ecosystems and dramatic land use and land cover changes, increasing the evolution and spillover of novel zoonoses to humans. The university have a role to play in helping communities cope with such natural emergencies. And I think what we've just seen before the session started actually gives an emphasis to the fact that our communities need to be prepared, our communities need to be self-reliant, our communities need to know that fear can actually be devastating. But at the end of the day, there's need for resilience. This afternoon, our webinar will provide an opportunity for us to explore actions needed for universities in Africa to reposition themselves in order to overcome the current and projected constraints of COVID-19, whilst examining what should be put in place to build capacity for preparing for, responding to, and monitoring of emerging and re-emerging pandemics. So we are delighted that this afternoon we have dynamic leaders in education, health, and of course in politics that will be part of this discussion. And I want all of you to feel welcome, to enjoy the webinar. It will be for 2 hours, but we do hope that all of us will have an opportunity to say something where possible. But if we can't, please send your comments in the chat box so that we can actually all be participants, active participants through the session. Before we proceed with the session, let me invite Dr. Florence Mayenga Nakaviwa, who is the Deputy Education Secretary, Executive Secretary for Roof Forum, to make her statement. Next slide. Then Dr. Nakayiwa is the Deputy Executive Secretary, as I've already said, for Planning, Resource Mobilization and Management. She joined the forum from Makerere University, where she has been the Director of the Planning and Development Department. She has over 20 years experience in higher education sector in Africa. She brings vast experience in institutional development in higher education, policy engagement, development partners collaboration and partnership development, and networking to the Forum Secretariat and its wider network at large. Welcome, Dr. Florence Nakayiwa.
Thank you very much, moderator, for this afternoon. Distinguished participants, panelists, and all those who have joined us in this third Roof Forum webinar. Roof Forum, a network of 126 universities in 38 African universities, is hosting this webinar series, and I welcome you all to this third webinar. This webinar series are part of Roof Forum's efforts to initiate dialogue and debate on how universities in Africa can generate homegrown interventions amidst topical challenges in Africa and globally. You will agree with me that the biggest global challenge for the year 2020 is the COVID-19 pandemic and its impact on all facets of life. While pandemics are not new to Africa, COVID has its unique attributes. It is coming on the backdrop of health systems in Africa that have been characterized as fragile. But we also recognize that its expanse on advanced health systems has not been lost to us. They have been affected as much as African health systems have been affected. So the question then arises, how do African institutions reposition to mitigate the impact of COVID-19 and other health challenges that are likely to emerge? How best can we develop the response capacities of universities in Africa? How do we build capacity and resilience of African institutions to deal with the effects and cope with future pandemics and other development challenges? The Roof Forum webinar series are part of this equation. They have been designed to target and get perspectives from all stakeholders of various facets. They represent opportunities for multi and interdisciplinary reform. Specifically, how can health, education, food security, and agriculture are interwoven? Through the series, we have already shared experiences from vice chancellors in Africa and Europe, regional education agencies, development partners, and other participants from all walks of life. The two webinars hosted to date have explored potential intervention to improve our higher education system and ultimately improve livelihoods in Africa. Both webinars highlighted genuine partnerships and the value of meaningful institutional and cross-sectional collaboration. They emphasize that public, private, education, health, and agriculture are all interlinked, and therefore response to that pandemic has to be holistic. Today, the panelists, as you have heard from the moderator, bring experience from across the divide. They will give us their views on the university's role in preparedness, response, and monitoring of emerging and re-emerging pandemics. Please join the debate and pay keen attention to the propositions they make. Join me further to thank our moderator and the panelists for today's webinar who have all agreed to join us, and all participants. We at RU Forum are greatly appreciative of your participation. Let me further take this opportunity to invite you to join us on the 15th of July, 2020 for yet another webinar, which will focus on agri-food systems in the new normal. We look forward to hosting you again. Please remember that the recordings for all the webinars are available on the RU Forum website. Thank you, moderator. Thank you, panelists, and thank you, participants. I thank you all.
Thank you very much, Dr. Florence Maega Nakaiwa, for such an inspirational speech. I do think that our participants and panelists have, I think, started on a high note. I think the issues you've raised are critical issues for our discussion this afternoon. And thank you very much for joining us and for hosting us during this webinar. Thank you very much. So colleagues, now we will move to our panelists. For this session, we have 5 panelists and 1 discussant. Our first panelist is Dr. Raj Tajuddin. Just want to be sure that Dr. Raj, you are ready now to speak.
I think he has not yet joined, Professor. We can move to the next one.
Oh, okay, so is the Honorable Minister here as well or not yet?
She has been having difficulty connecting. She will connect later.
All right, thank you. So we'll move to the third panelist, Professor Jean Johnson. So Professor Jean is the Vice Chancellor of Bloemfontein University. He has been Secretary General of the Swedish Research Council with scientific responsibility for medicine and health. Professor Jean arrived at Bloemfontein University in 2003. It's quite a long time. By then, he had accumulated 9 important years of research at Max Planck Institute in Freiburg, followed by a period in Toronto, working on blood stem cells and the immune system. He was awarded a prize by Lund University for a project he carried out during a summer break. He spent a lot of time on research strategy and how Sweden can support the best medical research in future. This afternoon, he's being requested to share how COVID-19 has affected Europe, the efforts to contain the pandemic, the approaches adopted in Sweden to respond to the pandemic, and specifically how his university has responded to the pandemic. Welcome, Prof. Thank you.
Thank you so much. Can you hear me?
Yes, we can hear you.
Excellent. So I'm actually going to show you a presentation. So I'm trying to share this. So thank you very much, dear colleagues, and thank you to the organizers for this exciting and important webinar, to having me joining this. I'm very touched by your actually presentation where you brought one important career move for me, and that was when I did a high school project during a summer break that actually did so that I approached science in the future. That was very nice that you picked that up. So what I'm going to do here now is to show you as an example our university, where I'm Vice Chancellor, Linköping University, which is in Sweden, 200 kilometers south of Stockholm, and how we have prepared ourselves for and how COVID-19 affected us. I will summarize, and I will also give some experience from Europe, from Sweden, and from our university. And as you said in the presentation, I have also been Secretary General for the last 5 years at the Swedish Research Council. And I actually have been in charge from lots of the national funding calls linked to COVID-19 during the last couple of months. I also have worked quite a lot with the European Commission on similar issues, in particular those that are related to antimicrobial resistance. So let me start by saying that you may have followed the media that Sweden has tackled this challenge with COVID-19 quite different than some other European countries. So although strategically it's the same goal, that the government's policy really has been to limit the spread of the infection, to ensure that the resources in the healthcare sector are available, to limit the impact on critical services, in particular when it comes to the elderly and senior homes, to elevate the impact on people and companies and reduce the impact on the economy. But in order to, what I really should say is that in comparison to other European countries, we have not had a society lockdown. We have, schools have been opened. It has been possible to go to grocery stores and so, and we have not really had a societal lockdown as many other countries. And I'm showing a map here of the whole world, and the colored, the dark areas here, this is Sweden. And this is actually showing the number of cases in the last 14 days, and update on July 1st. And we can see that Sweden, we have quite a lot of cases in Sweden at the moment. And that has been discussed whether this is due to our policy not to lock down society, or whether we actually have a quite frequent testing system now. So we have sort of, WHO has said that Sweden's strategy is interesting, but we do not yet know whether it was the right one or not. We have possibly one of the highest herd immunities in the world, but it's not above 20% at the moment. Another statistical slide I will share with you is this one. And it shows basically the reported cases per 100,000 population. And you see that Sweden is actually having the highest one in Europe. We also have a quite high reported deaths per 100 population. And this is mainly elderly people or individuals above the age of 80 and down to age of 70, and very, very few cases, as in most countries, in the young population. But in comparison to our neighbor countries, Denmark, Norway, Finland, we have quite a higher reported deaths than here. So the question is, did the lockdown fail or not? Or is it actually that we will avoid a second wave that may come in the next fall or winter, and then it will hit the other countries harder? We don't know yet which strategy that was the best. But I will, of course, focus on the challenges we have had in the higher education sector, and in particular at Linköping University. So the government had said quite clear that because of the some companies are actually laying off the workforce, there are a large challenge now of having new training and courses for the workforce to basically find new opportunities for new jobs and so on. And this is, of course, something that is really important for university as Linköping University. It was then decided that not the primary schools, but secondary schools and higher education institutions such as universities should provide distance learning, which means that we basically have closed our campus from end of March. Another important thing in Sweden is that most of the students are actually loaning money in order to study. We don't have a scholarship system in Sweden as in other countries. So you basically get support, but you also take a student loan. That has been a very, very important issue, that since you are actually not possible to continue with your study the way you were supposed to be, you don't have to pay this back now, or there should be not any demands on that. So to summarize what happened at Linköping University, I should say that the first indication that we had COVID-19 in our region was in the beginning of March. We already had a crisis handling group, but I think it's quite important to have already, regardless of which kind of crisis it is, if it's a pandemic, or we had it because of a bomb threat earlier years. But that was actually then reactivated immediately, and that was a very important step. We have had weekly reconciliations with university management, but also the Swedish University Network, which is all other universities. I should tell you that our university is the 5th largest in Sweden, with 4,000 employees and about 32,000 students, so quite a large university. One very important thing is to stress is that you need to have a very clear and transparent information with official announcements on the homepage. You need to have direct contact with students and employees by mail. And we also had a very, very clear instruction to all the heads of division and departments out in both the teaching sector and the research sector to inform the personnel. We have decided to follow the recommendation of the Swedish Public Health Agency, which means that we did not choose to have our own expert panels, which some universities actually decided, but we didn't do that. But in principle, we have had now for several months a lockdown. No seminars, no workshops, distant teaching, distant examinations, and very restricted possibility to perform research tasks. So the major challenge for a large university, for any university in a situation like this that dramatically affect both individuals and society, I think when it comes to education short term is teaching, of course. The goal should be to keep on your possibility to offer teaching. But this needs, of course, good IT solutions. This needs a preparedness for this. Another thing is, of course, all the examinations that needs to take place remotely, which in some cases is very difficult to deal with, such as mathematics and practical examinations, of course. And of course, also, since we are a large university, we also have a faculty of medicine, which means that health and medical care students could impact and help out on healthcare and society by offering help and workforce. There has been, in some regions of Sweden, very high demand of students helping. One very sad thing is, of course, that all the incoming students for exchange students have not been able to come to the university this semester. And in the same way, our students going from Lidköping outbound was also quite restricted. And there you need to find efforts to sustain distance teaching and webinars and so on. And of course, another issue that shouldn't be neglected is the student health related issues. Many students do actually come to our city and our university far away, and this situation could actually isolate them. And that's something you need to have a very clear plan and for. Long term, I think innovative IT solution is crucial. That is probably what we learn from this is, of course, that here we have a fantastic opportunity for new teaching and new courses and new programs. We are a very typical campus and program focused university. That's our fundament. Students should be here, but in a lockdown like this, we need to rethink for the future. And whenever there comes a new challenge, such as a new pandemic, we need to prepare, and we need to offer in the future alternative teaching courses, distant teaching. How do we deal with student recruitments and so on? Of course, this is a perfect opportunity to think about the pedagogics. How do you teach, and how do you efficiently teach and transfer knowledge to the students with IT measurements? And of course, there is also a perfect opportunity now when there are more people actually out there in unemployment that need new challenges and new education and skills to offer what we call in Sweden lifelong learning. Maybe this is a perfect opportunity for our university and others to offer new type of education. When it comes to research and innovation, we are one of our large profiles is in certain research areas, such as technical sciences, medicine, and so on. Of course, there will be a lag in a lot of current research projects. To ensure the ongoing research, a problem is, of course, funding. Whenever you have funding and you need to report and you have a lag in your research, how do you deal with that? Technical personnel, there are a lot of infrastructures that offers resources that are locked down, and then you cannot continue with the research. This is also something that I think is extremely important to think about for the young scientists, the postdocs and the young scientists establishing their independent research. There may be a problem with the threat of the career development because of this lag. And there is a major concern that you need to talk to them and you need to find a mentorship and you need to find a dialogue with the funding bodies. The only thing I should say here from this slide is also, of course, there are new funding opportunities, and I will share you some very quick slides on the funding opportunities that are being possible for the researchers at our university. So these are national funding calls from different agencies. So we have had one now opened for basic bio research, 10 million euros, that is really on the long-term capacity building because of this threat of a new pandemic, a new virus. We think one of the keys in the future is to capacity building for the new young scientists to follow on this route of science. Another very important thing is all the international collaborations and to share data openly in Europe and globally. The WH Solidarity Trial is one such example. And we also have agreements and now decided to have mutual projects together with South Korea, China, and Brazil. Of course, there is the issue of how to provide or to collect samples from patients, biobanking and clinical trials, but also a lot of research calls and innovation calls. The European Union, Sweden belongs to the European Union, of course. There has been a lot of issues and a lot of concern on how to respond to the coronavirus pandemic. The 27 European Union countries formulated something called the Era versus Corona Action Plan, and I'm not going into detail to that. But this was basically a very large funding scheme of 220 million euros, where Swedish scientists were also quite successful. There has also been a coronavirus pandemic call and several calls and response that deals with African countries. And these three, I'm not going to detail, I just want to exemplify that there has been in the program from the EU, the possibility for European scientists to join together with African scientists to work on issues, not only science, but also response and training. So these are interesting conceptual calls that I think is worthwhile to mention. Some of the general aspects for the future, and so I would say that some of the challenge we've seen is to ensure that students and employees follow the restrictions. We need to have a very high preparedness for digital teaching. Teachers need to challenge, to work together, to find the networks, to find the most optimal teaching instruments digitally. Of course, there is a problem wherever you need to use distant teaching and examinations, and this is something that you need to have a very clear plan to solve. One thing that I'm really not proud of mentioning, but I think this is a common problem, that we have seen in increased cases of plagiarism when it comes to student reports and master theses. Some of the examinations are now substituted by sitting at home writing together something, and this is something that we have seen. We also have certain restrictions when it comes to how many people can be in the lab performing research, and there we have seen that some labs are not really taking precautions, follow the restrictions. It's very clear to have a leadership that communicate top down but openly and transparently. And of course, there is this important issue to securing helping the healthcare sector, where I think our university with the Faculty of Medicine can really, really help out. So we are well prepared as a university. We have students that are willing to help. We have a very good communication and collaboration with the surrounding municipalities. We have an agreement already for healthcare education with the region, and in Sweden, the regions are in charge of the healthcare sector, so that has worked very, very well. We have, as part of our strategic work, already taking the necessary step for transition for the future. We have digital transformation for teaching that was extremely helpful for us. We had solutions to connect into international students and international scientists. We have a very, very high profile on innovative medicine that could be very helpful in this situation. And we really take the lifelong learning very critically. So I think that our university is there for the society, citizens and patients to benefit from our efforts. So thank you very much.
Thank you very much, Prof, for such I think, a thought-provoking presentation. I think the context you've shared with us is a very interesting context where there's been no lockdown, I think, as a society, but I think your cases are increasing, COVID-19 cases are increasing. But you've shared with us how the university has responded, issues of teaching and learning, issues of student loans, and also handling health and medical students. And I do know these are, global issues, although context may be different, but certainly the same issues that you are grappling with in your country, most African countries have similar issues. And I think particularly for Africa, issues of digital divide, the fact that not every student can have a laptop, and then perhaps even having airtime to use on their phone, issues that we are now having to deal with in our countries. But I'm impressed with how your university has responded despite all challenges that you've had. But to me, I see that you have a clear picture. I think your vision is very clear on how you handle issues. But also, as I've said earlier on, the challenges may be different, but because of context, but certainly are the same, I'm sure. Most of the participants and maybe fellow panelists here will agree with me. Thank you very much. And now we will move on to the next panelist. And this is now Professor William Bazell, Deputy Vice Chancellor for Finance and Administration at University, Makerere University in Uganda. He's a professor of occupational medicine and a medical doctor, and he also has an MMed in occupational health, a graduate of the University of Singapore. He has over 20 years teaching experience in Makerere University and is among the key pillars of Health Alliance, which was formed in 2005 with funding from USAID. He is also a lab director, chief of party for USAID Higher Education Network, Resilient Africa Lab, which is a consortium of 20 African universities led by Makerere University School of Public Health. He is also the current chair of the One Health Central and East Africa Alliance, USAID, in the EPT program through Respond. During this session, the prof will share how Makerere University has responded to some of the pandemics, including COVID-19. Also, he's requested to highlight some of the capacity needs, human and infrastructure for strengthening response to these and other future health needs in the continent, using Uganda as an example. So he will talk about diagnostics, laboratory infrastructure, clinical management, vaccines, among others. Thank you very much and welcome, Prof.
Thank you very much. I want to start by thanking you for inviting me to be part of this, congregation. I know this is a very hot topic now, and I want to thank Reforum for organizing this. I know Reforum has organized us many times in many other activities. I want to thank my colleagues, the panelists, and I also want to thank our minister for accepting to participate. But all in all, I think universities have a big challenge now. If there has never been a challenge that affects universities, it is now. Because challenges have affected our countries before, either in economics or financial sector, but I think universities have been affected most in a way that the challenge lies within us, the universities. We need to provide the answers. We need to provide the solutions to our countries, to our communities, to our people. And nobody can say that the pandemic would have come and would have known. No, wouldn't have known. And so the issue of saying that we are not prepared, I think does not arise now. We have prepared ourselves for many things, but this kind of pandemic, not in our generation, we have not seen it, so it would be very difficult. You very well know that Uganda has suffered most in all the countries in Africa through these epidemics and the pandemics of Ebola, Marburg, and others. But what has happened, and I want to thank our government and our Ministry of Health and our Ministry of Education, that we have been able to sail through because of what we have been able to put together as a team, one team collaborating different disciplines, different institutions. I also quickly want to say that when this pandemic came, and I'm sure that the minister will have a lot to say what has been done by the country, but I will say, what did we do as Makerere? How did we receive it? The news were not good, so it meant that what we had prepared for, say, Ebola, because Ebola is always in our neighborhood, which I must also tell neighbors that we are always available to help them. And those that get Ebola, we normally help them because we have prepared our people. But the pandemic came at a time when Uganda had suffered so much that we had devised means and worked with partners to set up certain structures that have helped us. These structures included the methodology of training our students. When we are training students in the public health and the medical profession, the veterinary profession, we have adopted the methodology of One Health, which has now caught fire in many African countries, and it is led from Makerere, whereby we have been bringing together students of veterinary, nursing, and public health, and medics to train them together to be able to identify the problem and work on it or solve it together. The second methodology that has helped us is community training, whereby most of our training programs have the field-based training, where students, both undergraduates and postgraduates, actually train within the communities, having the communities as their field, not only train them in class and labs, and then we set them off as graduates. For example, we have this program they call Masters of Public Health Without Walls, where 40% is class and 60% is actually the field, whereby the students mingle with the communities, identify their problems, make the diagnosis, find solutions. And veterinary does that, and the nurses does that. And we mix them up in what we call the student health clubs, students clubs, and they discuss these issues before they go to the field. The other thing that we found that we were prepared was what we call the fellowships. The minister may later on say, Uganda set up is one of the countries that have known that set up so many hubs for this pandemic. Uganda set up about 100 hubs. These hubs are in the communities, and they are equipped with students or graduates of the program of field epidemiology, whereby they are used to their communities, they are able to take the samples because they know there are many to be able to manage, identify the problems, the different problems, and how they interact with each other, then we're able to save the situation. So those are some of the methods. But the other method that was also in play, and we have developed it, and we are in the process of rolling out to the other universities, is training people without coming to the university. We have several programs that are on distance learning, and the others that are, we had already started them, having them to have these platforms, so that the platforms are available for people to share, and we train people. So when it came, it was like an ignition that we actually move our programs that do not need to be in contact, like lab, clinical, and so on. We move them to training them where they are. I must say that our university is approximately the same university as Professor Jan, who presented earlier. We have approximately 4,000 members of staff. We have 40,000 to 50,000 student community. So it's a large university. But this being the largest university in Uganda and the first one to say, some of the infrastructure does not match the teaching that requires so many students together. And because of that, we have these programs that are not necessarily on campus. And we are now working on them when, during this close down, we are working on them to actually become full-time outside the university, not full-time on campus. One, the advantage of that, we have looked at it. We shall be able to train more people. We shall be able to reduce the cost of training, so that even the people who register, whom we admit, pay much less. But it has a complication that we are trying to work on. And this complication includes accessibility to internet. Accessibility to internet in this country is not a guarantee. Several places don't have, I must say. But also, not all students have access to computers. So what have we done as Makerere? We have now been negotiating with manufacturers to provide students with computers which are affordable.
This internet is bad.
So, Prof, there seems to be a challenge with internet. Secretariat, can you assist us? Apologies to all our participants and fellow panelists.
Hello?
Yes, yes.
Yes, please, you can proceed now.
Okay, can I continue?
Yes, please. Yes, please.
Our Vice Chancellor has been able to work with these providers, the internet providers, to give us heavy discounts. And actually some of them have given us free, which I think is very good. And we will now be rolling it out to students and staff. But there are still pockets of our country that do not have this accessibility. And those are the ones that we now have to focus on. The other thing that we did, and I must quickly move because there are many presenters. I must say that our university has three main obligations. One is training, which I've talked about largely. And the second one is research. And the third one is community service. Now on training, we have looked at our classrooms. How do the students fit in these classrooms? If we are talking about social distancing, I have challenged people and very many people in the Ministry of Education and other countries on other webinars and Zoom calls that I would want to see a country where students can be taught and you have social distancing of 2 meters, even if you said 1 meter, it's very difficult. What do? We must, as scientists, come up with a mechanism. What can students do and faculty that do not necessarily have social distancing, but keep these students closer? My own suggestion, personal, is that if we enforced use of masks and proper use of masks, and you must have seen on different channels when you see in different countries, many people wear their masks below the chin. If we were to comply in universities and teaching institutions and we wear masks and wear them properly, have sanitized properly, cleaned our places regularly, check our people, screen them regularly, their temperature, then we would be able, and then testing those, rapid testing those that are suspected cases, we can have education back on its feet and have many students come back to university. When we talk of students who cannot come because they are not, who should come because of lab work and so on, even our labs are
to have lost the prof again. Francis, can you help us?
now. Before I said I'll talk about research, we must thank our government. The government of Uganda availed us resources to do research, which has informed our country. First, we characterized the virus in Uganda. How is it and how is it related to the other viruses that we are seeing in many places? You have heard people talk, and they talk out of without information that the virus in Africa is weaker and so on and so forth. The other day I had the former Prime Minister of UK speak, but we have characterized the virus, and now we know how our virus behaves. Secondly, we have done the mathematical modeling. When do we expect what to happen? And we, by following this,
Thank you very much. I just want to say, Prof, that you have like 3 more minutes to finish. Thank you. It's moderator.
Yes, 3 more minutes will be enough. We have also looked at what is it that other countries are doing, and these countries are using respirators, which our country didn't have, and has some, but they're very expensive if you are to procure. So we have been able to work on with our innovators, our scientists in Makerere. We now have our own ventilators here, which we have done. We have also worked on rapid testing. When I talk about rapid testing in the institutions that we want to institute, is that we shall have this testing done 20 minutes the student knows, you know what, if I have pandemic.
Prof.
So if it is us to educate the communities, we have done, and the Ministry of Health is working with us. Last for all of you, collaboration with other partners is very important. Professor Jan talked about those resources available, but you have resources, you need to have partners that are in the same field, you work with them, and we address this pandemic. Ladies and gentlemen, I'll stop there, and in the future we shall add on. Thank you very much.
Thank you very much, Prof. I do know we had some difficulties here and there, but I'm sure the audience was able to hear you. And I want to thank you for speaking from your heart. I think the example of your university and Uganda, what you've done as a country, as a university, is quite impressive. I like the fact that you've touched all the 3 elements of teaching and learning, research and innovation that is happening there, and of course the community service that you are providing as a university. I do know the audience may have questions, and reminding you and all panelists that please make sure that you are checking the question and answer toolbar so that you can check if there are specific questions that are coming to you, but also reminding all the audience that they can still use the chat bar just to give their comments, and we are monitoring what they're communicating with us and the panelists. I also want to remind you all that this session, the webinar session, is being recorded, and therefore information will be made available even after the webinar if people want to access any of the presentations. But at the same time, also just reminding the audience that there's translation in English, French, and Arabic. And for the Arabic translation, please use the Chinese version. That's where you can get that translation. We will proceed, and reminding the panelists that each one of you was allocated 10 minutes. And so we do hope we can still catch up on time. And we'll now move on to the fourth panelist. And our fourth panelist this afternoon is Professor Simeon Mining, who is a director. Professor Mining is a professor of immunology at Moi University School of Medicine and director of research. He serves as director of the Kenya National Innovation Agency, chairman of board of directors for St. Luke's Orthopedic and Trauma Hospital, Adelaide in Kenya, team leader, development of research uptake, sub-Saharan universities. He's also president and member of the Kenya Society of Immunology. He serves as an international advisory editor for the Tanzania Medical Journal and a member of the editorial board of East African Journal of Pathology. He has published, and I think we have a link there for the publications. I think you can get them even if you just Google Professor Simeon Mining, you see his publications. Welcome, Prof. And for this afternoon, in brief, he will just highlight what Kenya has been doing, and more particularly Kenya CDC, and also what universities there have done, more particularly Moi University. And then at the same time, also he will look at the critical technical gaps that African universities need to strengthen in order to have vibrant healthcare systems. Thank you very much, and welcome once again, Prof. Thank you.
Thank you very much, moderator. As the other participants, I hope you are hearing me.
Yes, please, we can hear you.
Yes, at Moi University, as my colleagues from Linköping University and Makerere have talked, the learning stopped in our universities in the middle of March due to the corona pandemic. And what the university have done is to translate some of the courses for postgraduates to online platforms. So our postgraduate students, both the clinical courses and the master's and PhD currently are on, but the undergraduates are still at home. Let me come to the purpose of the webinar today. I think the Moi University, in partnership with Moi Teaching and Referral Hospital and our North American and Swedish collaboration, have been undertaking research, and currently the diagnostics that are being done at Moi Teaching and Referral are spearheaded by the university and also the consultants from the hospital. From the onset, Moi University started in 1989 as the second medical school in Kenya. And at that time, we then formed a partnership with Indiana University and North American universities and Linköping University in Sweden, because we were going to have an innovative medical program where we were using problem-based learning and community-based education. These long-term institutional twinning that have been initiated 31 years are still very strong and have found a lot of use to us, and we have been able to have very distinctive values from the North American and the Swedish collaboration based mainly on the tenets of equity and fairness, mutual benefits, and policies that support best practices, commitment to the research culture and workforce for Moi University. The College of Health Sciences at Moi University has 4 schools: School of Medicine, which started as a Faculty of Health Sciences, School of Nursing, School of Public Health, School of Dentistry. We are also members of the One Health, and we have fulfilled the tripartite academic mission where we provide education, research, and community service, especially in the clinical area, where we are the largest provider through AMPAT of the HIV care in Kenya, in western part of Kenya. So we have had many partners, but I've singled out Indiana University, which brought 15 other universities in North America. And we, over the years, we have attracted infrastructure for research at AMPAT that has also been able to access over 142 million US dollars from CDC, USAID, from CEDA. And that collaboration then has brought in a very synergistic collaboration between the teaching hospital, which is a second referral in Kenya. And through that, we have learned experiences that if you can document your research programs and principles, you will have many partners. If you also establish a consortium of research partnership, which the forum has also been encouraging, and also enhance the international and national recognition in your areas and the networking, then tackling the COVID-19 pandemic has also then been felt by the university staff and the students. So currently, they are responding to very many calls, both for psychosocial support, also in the molecular levels and epidemiological studies. The university experts have teamed up with the national teams at the Ministry of Health in Kenya to provide the way forward in sustainability of these programs. So last year, through the long-term collaboration with Linköping University, we celebrated 30 years and also expanded our mutual understanding to include training in basic sciences research, PhD in immunology, and also Moi University is in an area where the sportsmen of Kenya and this part of the world come from. So we also are very strong in sports medicine, and in collaboration with Linköping University, we have also been able to undertake research in that area. So given the pandemic, we think together with many like-minded universities in North America and in Europe, with these funding opportunities that our collaborators are now applying, we shall be able to bring in the implementation strategies that can also save the continent of Africa. I must also say that Moi University was lucky to have a World Bank project funded for the East African universities, and that has strengthened our textile factory. We are a university who have a manufacturing in textile, So during the pandemic, we were able to assist the country and the Ministry of Health by producing reusable masks, PPEs for the frontline staff. So as a university, that has also been our contribution. And lastly, together with the North American partners, we have also to have homegrown solutions. As one of the speakers from Makerere University, in this part of the world, you realize that critical equipment for taking care of patients, like the ventilators, and when all imports were not forthcoming, so our researchers, together with other colleagues in the health sector in Kenya, have been able to come up with low-cost ventilators. So I think this pandemic has then demonstrated that no organization today can be entirely self-sufficient or isolate themselves from what is transpiring elsewhere. Therefore, this webinar and the networks that True Forum is creating are very important for this part of the continent to train that caliber of human workforce that is able to combat the pandemic. And lastly, I think the partnership across the different zones of the world, north, south, resource scarce, and resource endowed societies is affirming the importance that we all have in common as human beings to assure us the diversity with our human and intellectual community, as well as the solidarity for purpose. May I stop there for the sake of time? With the other participants, we will take up the questions. Thank you very much, moderator.
Thank you very much, Prof. Simeon Mining. I think I like the emphasis you've given and from your heart on the importance of partnership, because I think the issue of partnership is critical. And you reminded me about what you want to go far, go together. If you want to go fast, you can go alone. And I think that's what you've demonstrated in your presentation. I think how you've worked with universities globally and what the impact that's been in not only in Kenya, but also all other African countries, opportunities that are there. And I think COVID-19 brings, the energy to all in universities to know you cannot do things on your own. We need to work as partners. And maybe on a lighter note, so as some of you have noted, I'm a Vice Chancellor of the Malawi University of Science and Technology, a young university. So listening to all of you, my seniors, I'm thinking, please make sure you take on board young universities so that we can make progress. And now moving on to our first panelist who was not there at the beginning, but we want to welcome him, Dr. Raich Touch, and he will now give his presentation. And just a reminder to him that we are giving 10 minutes. I know that we a bit slightly behind time, but I'm sure we will catch up on time.
All right, thank you, Prof, for the opportunity to be part of this webinar. First and foremost, let me convey John Nkengasong greetings to the distinguished panelists. John would have loved to be part of this, but because he had to travel for some other engagement, so he couldn't make it. So without further ado, may I share my screen? All right. So can you see my screen?
Prof. Matala may have to stop the screen sharing so that Raj can share.
So can we see now? So, all right, thank you so much. So let me start by saying that Africa CDC is a specialized technical institution of the African Union, and it was launched in 2017, precisely on January 31st, by the African Union Assembly of Head of States and Government. As we can see there, that was then chair of the African Union, President Alpha Konari of Guinea, and Madam Nkosazana Dlamini Zuma, the then chairperson of African Union. So going to the topic of our discussion today, which is focusing on emerging and re-emerging infectious diseases. Right from outset, sorry, can you see my screen?
No, can you start afresh?
Oh, okay. Is it fine now?
Yes, it is.
Yes, it's, yeah.
Okay. So this is actually the. Okay, so let me just proceed. Okay, so the big question is why the need for Africa CDC? I think the simple answer to this is the fact that Africa continue to suffer from recurrent emerging and re-emerging infectious disease and outbreak. And of course, a lot of reasons have been ascribed to this. One of such is the fact that our population is rapidly growing, and it's estimated that by 2050, we should be talking of 2.5 billion. Currently, we are around 1.3 billion. Of course, climate change is also there. We have rapidly increasing unplanned urbanization is also a big issue. Internal conflict leading to displacement of our people is a big issue. Mobility of our people, deforestation, weak resources. These are all some of the reasons why we continue to face repeated or recurrent epidemic outbreak. Okay, so moving on to COVID-19, again, you know that we have very fragile health system. If you look at our member states, you discover that less than 50% of our member states actually have access to modern health facilities. When you look at budget, again, quite a lot of our member states are spending less than 10% of their GDP on healthcare, as against 15% that was agreed upon in Abuja. When you look at human resources for health, in most places or in developed world, what you have there is 25 health workers per 1,000 population. But in Africa, what we have is on the average 2 health workers per 1,000 population, which again is a critical gap as far as responding to any disease outbreak is concerned. At the African Union, we have what we call the Agenda 2063, and as part of the first 10-year implementation plan is to have what we call the Africa Continental Free Trade Agreement. You will agree with me that if this is put in place, because we are hoping that by January, this free trade area will start, this is going to bring about one single African market and will bring people together. So whether we like it or not, this will have a lot of public health implication. We're also moving towards single air transport and market. Already there's a lot of mobility. So bringing this on board again, surely we bring the 1.3 billion population on the continent together in such a way that public health become an issue here. We're also moving towards single African passport, again, with a huge public health implication. So what have we done with the universities as Africa CDC? We've partnered with the Association of School of Public Health in Africa so as to ensure that, whatever training that is out there clearly aligned with reality on ground. We partner with some couple of universities, University of Abit in terms of training of epidemiologists, Redeemers University in Nigeria in terms of a pathogen genomic sequence. In Morocco, again, we partner with École Nationale Santé Publique in the aspect of training of epidemiologists, and we have partnered with a lot of research institutions, which are one form of affiliation or the other with the different universities on the continent. So what is the COVID-19 situation today in Africa? I'm sure maybe some of the previous presenters must have highlighted this. For point of emphasis, today we have over 400,000 cases on the continent. We have over 10,000 deaths, and we have close to half of these cases have actually recovered. But more importantly, if you look at our trajectory, you see that we are still ascending. We have not yet reached the peak, neither have we plateaued. So we don't know. So these cases are still, or this pandemic is really, really evolving. So all hands need to be on deck if we are to control this pandemic. So if I unpack what we are seeing on the continent further, you will see that we have about 7 countries, that have reported quite a lot of cases. In fact, it consists of about 65% of the cases we are seeing on the continent. We have South Africa, we have Nigeria, we have Ghana, we have Cameroon, we have Algeria, we have Egypt, and we have Morocco there. So again, this further portrays the fact that we really need to stand up and collectively address this COVID-19 pandemic on the continent. So what have we done as Africa CDC? Right from outside, we recognize the need for coordination, collaboration, cooperation, and communication. The first case in Africa was detected on 14 February 2020 in Egypt and Cairo. A week after that, the African Union, through the chairperson, convened high-level emergency ministerial meeting. These are ministers of health from all the 55 member states. And the outcome of this particular meeting was that the continental strategy was endorsed, a continental task force was endorsed, and again, emphasis was placed on the need for coordination, communication, cooperation, and collaboration. So what have we done as Africa CDC? So technically, what we are doing and what we have done is guided by 3 main pillars. 1 is to prevent transmission, 2, prevent death, and 3, to prevent social and economic harm. So if you allow me to unpack this strategy further under prevention of our transmission, so what we are doing here is to make sure that we conduct lab diagnostic training for all the member states. At the outset, that's early February, there were only 2 countries in Africa that could diagnose COVID-19. By the end of February, there were around 43 countries that could do that. This was courtesy of what Africa CDC did in partnership with some other public health agencies on the continent. And again, we were able to distribute a lot of our test kits to coordinate the testing that is being done on the continent. And we also work with a lot of partners who are going to share or donate equipment to Africa. So one of these particular partners is Jack Ma. We also conducted surveillance training. We conducted infection prevention and control training. We stood up a weekly online clinical management, which currently we have over 5,000 clinicians on that platform who weekly come together to discuss what we need to do going forward as far as our management of those severe to critical cases of COVID-19 are concerned. We also deploy technical experts to support our member states. We conduct training on risk communication. We conducted some training on the community engagement as well. We also deployed a lot of guidance documents to support our member states. About 4 weeks ago, recognizing the fact that a lot of our member states who earlier on locked down their countries have started opening up. So we needed to guide this process so as to avoid needlessly loss of life. So what we did was to set up or to roll out what we call Partnership for Accelerated COVID-19 Testing on the continent. And the goals of this initiative was to conduct 1 million tests in the first 1 month and 10 million tests in 4 months. to establish a pool procurement platform so that we have access to this medical supply that ensure supply globally, to also put in place a logistical mechanism to distribute this medical supply. We know that all these efforts will not be possible without deploying health workers. So part of this initiative is to deploy 1 million health workers to support this initiative. And of course, to also leverage on existing technology on the continent. So this PACT initiative is underpinned by test, trace, and treat. Test is to make sure that we test each and every suspected case on the continent. Trace to make sure that we trace each and every contact of a positive case, and a treat to provide the necessary care for all positive cases on the continent. So when we started this initiative, we were just around 500 tests as a continent. So we are proud to say that today we have hit around 4.7 million tests on the continent, and this has actually changed the landscape as far as response to this COVID-19 pandemic on the continent is concerned. So one thing that really is a big challenge as far as Africa is concerned is the limited clinical trial that is going on the continent. So I just pull out this the clinical trial as far as the vaccine landscape is concerned. So we see that we have about 129 candidate vaccine in the clinical stage and 13 in the clinical stage. Only one for now is in Africa. The rest are in the West, that's Europe, North America, and some in China. Of course, this is not acceptable at all to us as a continent of 1.3 billion people. So this is where we want the universities, the academia, the research institutions, to stand up and be counted. So to further address this vaccine issue, about a week ago, African Union through the Africa CDC carried out what we call the Africa's leadership role in COVID-19 vaccine development and access, with the key objective of one, to highlight what we need to do as far as vaccine research and development on the continent is concerned. 2, vaccine manufacturing in Africa. 3, to ensure, how do we ensure affordable and equitable access to COVID-19 vaccine when it does become available. Issue of ethics and community engagement was also key. And of course, the issue of our supply chain and logistics, all these were clearly articulated at that meeting. So I'm more than glad to share the communique at the end of that meeting with this great audience. So we're also guiding member states in terms of guidance documents. So we're doing this together with a lot of partners, including WHO and other public health agencies on the continent. And one of these key documents is the one on mental health and the psychosocial support for COVID-19. Another critical document is continuity of essential health services. Just permit me to say 1 or 2 things about this particular guidance document. If you all recollect, in 2014 to 2016 in West Africa, over 11,000 people died from Ebola, but much more than that number died from other essential health services like malaria, TB, and HIV/AIDS. So we need to avoid that this time around. So Africa CDC felt that it's very, very important that we put up a protocol to govern the delivery of essential health services. This includes, but not limited to, maternal and child health, sexual and reproductive health, HIV, TB, and malaria, and non-communicable diseases. And we should put in place a mechanism that will monitor the performance of these essential health services and address the gap. And for every time we are talking about COVID-19, please, as much as possible, let's emphasize the need to continue to run our essential health services. And of course, as we plan for recovery, we should not forget these routine services are as important as our COVID-19. So in summary, these are Africa CDC asks from the academia, from the universities. So we want the universities to play a big role as far as human resources for health is concerned. The prof from Kenya talked on what they are doing as far as field epidemiology and lab training program is concerned. So how do we ensure that this program fits for purpose? As I'm talking to you, there's a lot of challenge as far as that training is concerned. So how do we address those challenges? So in that regard, we have published a document called Framework for Public Health Workforce Development in Africa. So we'll be more than glad to work with the academia in this regard to ensure that this our fellowship and training is able to serve what is meant to do as far as the continent is concerned. We are also calling on the university to also step up as far as the research landscape is concerned, in terms of response, in terms of vaccine, therapy, and diagnostics. And of course, the universities also have a role to play as far as responding to outbreak is concerned. In fact, not just a responder, but a frontline responder in the aspect of surveillance, in the aspect of testing, in the aspect of case management, infection prevention, and control. We also want universities to play a critical role as far as knowledge management and evidence synthesis is concerned. There are a lot of guidance documents, there's a lot of publication out there, but how do we translate this knowledge? So the universities need to step in here and assist or work with the public health agencies on the continent. In terms of innovation and technology, we also want to rely on the universities to step up again and be counted. In terms of oxygen, what do we need to do to ensure ready availability of oxygen to all our member states, especially the fragile and the vulnerable member states? Personal protective equipment, these are low technology. Again, our universities need to play a key role here to build the capacity of our manufacturing sector so that they are able to provide or to produce these PPEs on the continent. Low-cost ventilators is also another area where we want the university step up, work with the different pharmaceutical or the medical supply companies on the continent, and they come up with what is going to be affordable and be able to support our COVID-19 response as far as the pandemic on the continent is concerned. Diagnostics, we all know that one of the key things we need to do going forward here is to accelerate and scale up testing, and we also know that there's global shortage of these test kits. So what can we do locally? So we are calling on the universities as much as possible, ensure that the local capacity is built to what, at least we may not be able to produce everything we want, but at least to be able to complement whatever we are importing from outside. Africa CDC has set up a pool procurement platform. So we
Are you there, Dr. Taj? I cannot hear you.
You might be having a problem with this connection.
Okay, and Hope is concluding. Should we proceed to the next presenter? Because I think he was nearly finishing.
Yes.
Thank you very much. I think this was a very brilliant presentation. I think the African perspective, well elaborated, and what should we do? What should investors do? I think his last slide is the key message: human resources for health, research, how do we respond to surveillance, testing, care, and knowledge management, as well as innovations and technology. Very good presentation. I would want us to move, because we're actually running short of time, to the last presenter on the panelist, and I do hope that the Honorable Minister of Health in Uganda is now online.
So thank you. Apologies for that interruption. I think that will be that. Thank you for the opportunity. Over.
Brilliant. Thank you so much. Thank you very much. And look at your Q&A, quite a number of comments for you. Thank you.
I didn't hear.
The Honorable Minister.
No, the minister is still having problem connecting, so we can go ahead
Okay,
with it.
so we will now move on to the discussant. And our discussant this afternoon, as I said, this afternoon or morning or evening elsewhere, is Professor Johan Soderholm, who is the Dean of Faculty of Medicine and Health Sciences at Lipkin University. And he's going to be speaking to us this afternoon. Well, and his research is about mechanisms of origin of disease group, chronic inflammatory bowel disease, and ulcerative colitis. He has a lot of experience, over 120 publications, a true professor. Welcome, Professor. And what the professor will do is just look at what has been presented, and he'll pull through some of the issues, give his own views, and just look at the linkages because the presentations were quite interesting and diverse. Thank you very much, Prof. This is your time.
Thank you so much. Thank you very much for inviting me, moderators, Professor Malata and Dr. Nakayiva, and my distinguished panelists, Dr. Tajuddin, Dr. Aseng, Professor Jönsson, Professor Balzeo, Professor Minning, and dear colleagues. Good afternoon, and thank you once again for inviting me. I would like to share my screen, and we'll go on doing so. So, see if I can have a presentation mode. So, do you all see my screen now? I hope so. I will start off with a few bullet points that I was thinking about before when I got this assignment, and then end off with a few points that our panelists have touched upon. So in education, as many also have already said, we had to reorganize teaching and meetings to online mode very quickly here. This has been good for less travel with less carbon dioxide imprint on climate, but less travel also has downsides, of course. Less social interaction, fewer new contacts, closed down for international students, and a long-term risk, as I say, for more nationalistic views, unfortunately. But it brings new opportunities with webinars, teaching, examination online, and so on, new teaching methods that we can use with many advantages, but also need for expensive infrastructure, which is a drawback for in some countries in Africa. Also new opportunities that we have to start using is internationalization at home, so to say, with recurring webinars in teaching together with universities abroad, mixed tutorial groups perhaps between partner universities and so on. And this is something that we have to start thinking about in this new situation. With education also in our country, and also that's some of the panelists alluded to, is that there has been an increased interest for healthcare professions and increased admissions to our programs. On the other hand, there is less. The healthcare system has less time and less place for our students currently. The situation has also brought upon a secondary economic crisis with increased governmental support to higher education and increased focus on lifelong education. But the economic crisis has also increased the risk for nationalistic views. This has been seen within the European Union, where they have closed down borders for personal protection equipment and so on. Our role as universities are traditionally that we are open-minded institutions with extensive international interactions, and it's extremely important that we find new ways to keep up with this very important tradition, is certainly, or especially in these times that are now. If we then go to research, just a few examples here from when we had an extra call for regional funding for COVID-19 projects during the spring. It was obvious that the issues that we have are also the same as you have presented earlier during the panelists. Immunology and vaccinology, obviously important. Intensive care with prevention of brain and heart injury, rehabilitation post-ICU. With we have had problems with the long stay in ventilators up to 6 to 8 weeks with multi-infarction and so on. And also not to forget the social health issues in the pandemic with increased risk of domestic violence and mental health issues in closed societies. Even if we haven't had a total lockdown, we have seen an increased tendency to these issues. Concerning antivirals, we have participated in some international trials, but Sweden has been slow in a response here. We need to work on preparedness and organization, but here we need nationwide and international projects, I think, because the European Union has a challenge here. We haven't really stepped up as a union during this crisis, I think. If we look at healthcare, our teachers, both professors and lecturers with healthcare professions, have been made available for hospital work part-time, and senior students have also been made available for healthcare work. Within the healthcare system, there have been problems with supplies of personal protection equipment, especially in the initial phases during March and April. There were problems with supplies of medications for ICU care, for example, sedatives, and also capacity to increase the ICU beds rapidly. And as I mentioned before, we need a better nationwide collaboration for organization and also an international organization for this. Sweden has a very decentralized healthcare organization, and this has definitely been a drawback here, and we have responded quite slowly with the organization for the pandemic really starting mid-March, and as you heard just a couple of minutes ago, the CDC responded in mid-February already. So what happens post-pandemic in the healthcare system? There is a risk for missed vaccination programs, misdiagnosis of other diseases such as tumors and so on, and also an increased risk of mental health issues in the closed societies. So we really hope that this is starting to end and change very soon. We want to start traveling again, and I don't know what happened here. Want to meet each other, and this is last year when I visited Moi University to renew our exchange agreement, and it's been always been very rewarding to coming to Kenya for this collaboration that Professor Minning mentioned before as well. If I go quickly to some of the things that the panelists raised here, Dr. Tajuddin, I was impressed by the rapid response by the CDC, and also it's obvious that Africa works very well now with working together. With the free trade agreement, free mobility, and also the joint African passport union and partnerships in academia, and seem to be very much working towards something that resembles the European Union. And also important point raised, I think, were what we should expect from the universities with health or human resources for the health professions, with research in diagnostics, treatment and vaccine, be frontline responsive in surveillance, testing and care, the knowledge management with working on evidence-based guidance, which is very important, especially in emerging pandemics where rumors start to come up very quickly. And also, of course, coming with innovation and technology for the needed medtech for novel treatments and PPEs and so on. From my VC, Professor Jan-Ingvar Jönsson, who talked about the high numbers of cases in Sweden, and it's very unclear still if the non-lockdown of our society was the right strategy to avoid a second pandemic wave. With the issues we've had within the university, it's important to remember now the stop in incoming and outgoing international students. We have to start our international interactions again, as I mentioned before. The lag in ongoing research can be detrimental for PhD students and young researchers, and we have to work towards this and avoid it being detrimental. On the other hand, we feel well prepared for the new situation, and there is willingness in the society and at the universities to work together to get us through this. I saw there were a couple of questions here about plagiarism and top-down during crisis, but we can come back to that, time permitting. Professor Bazeo talked a lot about the One Health program with students from various programs training together in the communities, with the fellowships of student hubs, and then moving to training in distance learning. And that this was an ignition to move training to where students reside. And it's a new way of thinking of the universities. And this has also been obvious at our university in Linköping, where we have been very much focusing on campus-based teaching. And now we are forced to move more to distance teaching. And it has worked fairly well and surprisingly well with this move, actually. But you need the resources, you need the computers, and this program in Uganda with internet providers that can bring affordable computers to the students seems very important in this setting. I'm also very impressed by the community service that you have rapidly done in the universities that several of you have mentioned with the low budget solutions for respiratory aid, and how to work with personal protection and so on. And as lastly, Professor Minning mentioned the production of PPEs, also the affordable solutions for ventilators, and stressing the importance of the partnerships for accepting diversities between areas of the world. And I really agree here that this is very important, and if this, so to say, stop or an almost stop in traveling goes on for a long period of time, it's extremely important that we have these kinds of webinars and interact as much as we can at the international level. Thank you, and thank you for giving me the opportunity to present.
Thank you very much, Prof. Johan, for a very good discussion. You have really looked at each presenter, and you've also given your own thoughts about each of the topics that our panelists were addressing. You've really done very well. I also like the approach of looking at some of the questions that were raised by the audience. So it becomes even easier for our panelists to respond to the questions. I do think that probably we may not have the Minister of Health present this afternoon, and probably that will be sorted out later on by Ruforum. I'm sure people would still have loved to hear from her. So my request now is that we go to the question and answer session. And because our panelists were following the questions, I'll first give each of the panelists a chance to respond briefly to some of the questions, and where possible, you can type the responses because some of you have quite a long list of questions, but I think just try to pick on the key issues that keep coming to you and respond to those questions. And then I'll also eventually give a chance to a few people from the audience to respond, to ask questions live, and a secretary to assist me with that. So firstly, to Africa CDC, I think you, Dr. Raj, you have a number of questions, and I wanted to ask that perhaps you respond first, and then we'll move on to the other panelists. Thank you. And let's make our responses brief, please.
Okay, thank you, Prof. So I'll try to be as brief as possible. Let me start with a question from South Sudan. Currently, we do not work with University of South Sudan, but we are working closely with the South Sudan National Public Health Institute. In fact, we are working to make sure that that institution is fully set up and giving them all the necessary technical support. On the issue of the role of traditional medicine and healers as far as the COVID-19 response is concerned. Yes, I agree with you. They have a critical role to play, especially when we know that in some settings in Africa, more than 50% of the populace, that's their first point of call. So we need to get them on board, especially in the area of surveillance, in the area of risk communication, in community engagement, and more importantly, management of rumors and management of misinformation. So we need to get this group of people on board. In terms of traditional herbal remedy, quite a lot are out there, but in terms of those that are registered, I think they are very few. And for Africa CDC, I think the one that readily comes to mind is one from Madagascar, the COVID organics. And in this regard, we are working with WHO to understand the safety and the efficacy. And there's a kind of high-level discussion going on now between the Africa CDC, WHO, and the Malagasy authority to understand this, and then look at how do we, take that the finding from Madagascar, how do we take it further so that we can advise our member state as appropriate. I think that will be that from what I've been able to capture from the Q&A session. So once again, thank you for the opportunity.
Thank you very much. I think you've seen quite a number of chats from the audience. I think they were very impressed with, I think, the overview you've given about what AU is doing about COVID-19. So I think I'll now move on to Prof. Jan Johnson, the Vice Chancellor. You also had some few comments that came from the audience. Do you want to respond at this point?
I could. I received a couple of questions that I also already answered, but one of the key questions I was going to say is that one of the motto I have seen for some universities in Europe has been, for every scenario, the motto should be on campus if we can, online because we can. But I do acknowledge the fact that in many African countries, internet is not as stable and as in Europe. So I think I would state a new motto that would be something like on campus if we can, online because we can, offline the innovative opportunity. And here I do see possibilities for European universities, my own university, and Africa to connect and to find new solutions to try to change the future of education. I think we need to be more flexible in the future in the sense that we need to have flexible syllabus. We need to accept that you can actually get the information and the knowledge within the course or a program in alternative and different ways. And we need maybe to face that education not necessarily need to be on campus with the tools and the courses we can provide, but you can actually gain it from other universities. And that it would be actually very good because this would also lead to the future type of teaching, innovative solutions, and connecting the world and the students more together. I think one important thing also to say where we as universities have a very, very important challenge and responsibility. That's research, first of all, to understand and combat the coronavirus and future pandemics. It's also to contribute to healthcare issues and maybe to societal challenges. And is also to be willing to share data, to share research results, donate equipment, to provide manpower, and in particular, brain power. That would be my closing word. And thank you very much for a very, very nice webinar.
Thank you very much, Prof, for your responses. The question from Gloria, who is asking, why is it that most medical schools withdrew students from clinical area? Was this a right decision? I will not ask anybody to respond at this point, but I think at the end of this round of questions, I'll ask that perhaps our discussant should look at that question. Was this a right decision to withdraw students from medical students from clinical area, medical nursing and all other health professionals? Our students were withdrawn, was this right? But I'll move on now to Professor Bazeo, Deputy Vice Chancellor Makelele. You also had some comments. Do you want to look at those?
Thank you, moderator. And I want to thank all my colleagues who presented, and I think they have brought in new light to some of the things that are being done in different countries. And I'm sure they will help us when we are also reshaping ourselves. But one thing that maybe I come to this question of the last one that you gave, I haven't seen it, that students were withdrawn. I think it's if it was for universities to close, it becomes very difficult to close and then keep others on. But what I know is that many of our postgraduate students, we requested, and the ministry requested us to keep them in because they are actually the right-hand men and women in these hospitals. So they were there. And I also want to mention that when all the research, I'll tell you that Makerere University has commissioned more than about 117 research projects on COVID. And this is all funded by the government of Uganda. And we are doing a lot, and a lot of results are coming in. Somebody gave me a question about the virus, and I have replied to that, and I'm willing to share the findings with them on mail because she has given me, or he or she has given me the email address. But since I didn't have several questions, I'd like to add one thing, that if we do not take action, this COVID will cause other crises. We should avoid having our universities become the hotspots of COVID if we do not do the right planning. Because as much as the patients are there out there, and they come into the community and they go into hospitals, when we bring these universities, when we open these universities and institutions, and we don't do the right thing, there will be the hotspots for the infection. And we must avoid that. But also, we must also look at how do we sensitize the communities so that the communities become the police of their own health, not to wait to be sick or see somebody sick and you do not know. We must have our students know and understand what it is, whether we do it by the methods that the methods we are using to teach, so that they become our ambassadors in the communities. The ministries, all the different ministries, need the students to do a lot of work to sensitize our communities. Lastly,
We've lost you again.
I'd like to comment on opportunities. Am I back? Hello? Hello?
Yes, yes, please. You're back. 1 minute.
Lastly, I must close because I think my internet is disturbing me. I think we need our governments, as much as their institutions are working together, as somebody said from Moi and so on, we need our governments and our CDC, ADIS, to actually mobilize us, share what you have with all the institutions so that we are all on the same page. We should not leave behind any neighboring country, any institution. If we do, we will create our own crisis. If, for example, Uganda leaves out DRC, we are creating our own crisis because students cross borders and our people cross borders. We must work together to make sure that we eliminate these pandemics together, not singly. Of course, I wouldn't want to say here that I criticize. When Ebola was here, many countries shunned Uganda, shunned DRC, but we have put in a mechanism to make sure that everybody is on board. Thank you very much. Thank you for organizing this webinar. Thank you very much.
Thank you very much, Prof. I think that's the Africa we want. And moving on now to Prof. Simeon, there's a question about collaboration because you are the one who really took time to talk about collaboration. The question is, why should collaboration be between Africa and North America or Africa and Europe? Why not Africa within Africa? And I think maybe that's just an observation and I want you to comment, but probably if there's time, we could also give maybe a minute or two to our Deputy Executive Director to give us a comment on that collaboration. I think people still want to see more collaboration within Africa, but I give you this chance, Prof.
Thank you very much, moderator. I think maybe the perspective was taken out of context. Moi University was the second medical school in Kenya, and it was our Minister of Health who approached Sweden looking for an innovative medical school. Canada, which was McMaster at that time, and Maastricht. And finally, Linköping came on board in 1989. But since then, Moi University, we have more than 40 active memorandum of understanding, and it's not only with North and South. We have very many South-South collaborations. My postdoc has just come back from a 2-year postdoc fellowship at Stellenbosch. We exchange our students going to universities in Egypt, in Alexandria, in Cairo, and we have a number of the World Bank funded projects. We are collaborating with all corners of Africa, North Africa, Southern Africa, East and Central Africa, West Africa. So I think it is the way, the needs of each university. And we have a lot of joint European Union proposals together, either as co-applicants, as partners with universities in Africa. And usually we only select one university in the north. Like the recent EU application for the intra-African mobility, it is only Linköping University, which is the northern partner. The others is University of Cape Coast, Makerere University, Moi University, and so forth. So we really have a lot of partnership within ourselves. Thank you.
Thank you very much. Just asking if any of the panelists have got any question that they would want to quickly respond to. We just have a few more minutes now to finish this session. And my apologies that we do not have adequate time for, I think, like any people in our audience to ask a question. But do any of the panelists want to comment on anything quickly? 1 minute, please.
All right. Can I just say something?
Yes, please.
Okay,
And also,
thank you again, Madam Moderator. So there is this question of whether wildlife have been involved or not. So I think for now, what we have is few instances of pets being involved as far as COVID-19 infection is concerned. We are yet to have any documented cases of wildlife involvement, especially in Africa. But again, this question underscores the importance of One Health as far as responding to any emergency, infectious disease outbreak is concerned. So One Health is very key as we respond to any emergency outbreak on the continent. Thank you. Over.
Thank you very much. I also noted, I think, Prof. Johan, you wanted to also say something?
Yes, thank you. I could just comment on your own question about the clinical rotations for students. And in Sweden, the universities have had different solutions with this. Our students have all continued their clinical rotations and follow the guidelines of the healthcare system. And it's only been in very special circumstances where when the ICU had a heavy patient load during a period of time that they stopped having students there. And but we've been very, what we said to our students is that they can't really expect the same teaching as usual. They have to be there not only as students but also as assistants, because they see that there's a very high workload for the healthcare system. But it has worked very well, actually, and I think stopping clinical teaching totally because of COVID-19 is maybe not the right way to go.
Thank you very much. Anyone else on the panel? You want to perhaps make a comment? So it's I think our time is gone. I do want to ask the Secretariat if they have any announcement to make before I make my concluding remarks. Thank you, Francis.
No, you can go ahead.
Okay, so thank you very much. This was a very interesting session. I think I personally enjoyed it as a moderator. I think we had brilliant presentations, and I think all our speakers, they actually spoke from their own heart. You could see that they have passion for what they're doing. And I do think that we all can agree that preparedness is critical, is important for our universities, and that yes, we need to build capacity, and capacity building both in-house, but also looking at how do we work together, so that the issue of partnerships has come out very strongly. There are opportunities, there's funding out there, and I think also just looking at what the AU is doing, we can also know that even within Africa, there is that support, but I think international support, grants and donors that are willing to support work is something that we need to take hold of and use that as a platform for making sure that we come up even with innovations in our own countries, low-cost innovations, but innovations that can make an impact. I think at the end of the day, we have a responsibility as academia, as universities, as research institutes to respond to COVID-19 and to make a difference. When everything is said and done, part of the history will be, what did universities do in Africa? What did they do in Europe, in America? I think there will be that question. And I think we should be creating those answers now as we work together. I want to thank the forum for organizing this, this webinar. I think it was worthwhile. I think we have learned a lot. There's a request from the audience that there were some problems with, I think, reception in certain circumstances, and they're asking where their PowerPoint presentations that they should be shared. And I want to remind the audience that this whole session was recorded, so you can still access everything that was said, and you can actually, access it as quickly as possible. I think the forum secretariat are already working on it. Thank you very much, the forum. Thank you very much, our panelists. You have been brilliant and inspirational this afternoon, and I want to wish you a good rest of the day. For those of you who are going to bed, have a good sleep, and those of you who are starting the day, have a good day. And I was your moderator, Adres Malata. Thank you very much for being there this afternoon or today, 3rd July. Thank you.
Thank you.
Thank you very much.